And we'll move on to Ms. Emily Halcon. Welcome.
Thank you. Thank you. Good afternoon, Senator Leno and members of the committee. My name is Emily Halcon, and I am the Homeless Services Coordinator for the City of Sacramento. I want to thank the committee both for holding this hearing and also for inviting me to share with you perspectives from local governments who really are grappling to provide meaningful assistance for our most vulnerable citizens, but also ensuring the public health and safety of our larger communities. We are, as you know, you live here as well, or you're here quite often. These are not easy conversations to have locally, and there are no easy answers. We are dependent on and very, very appreciative of all of our partners, governments, business, nonprofit, the faith community, and many others, and we're very excited for the support from our state legislators through the No Place Like Home initiative. And as you heard earlier, while both national and local data objectively tells us that the numbers of people experiencing homelessness overall is decreasing, or at least staying relatively stable, in Sacramento, like in many communities throughout the state, it certainly doesn't feel that way or look that way as you walk down the streets. The city is hearing every day about homeless encampments in neighborhoods far from the central city who 2 years ago would never have seen a homeless person, much less an encampment in their neighborhood park. We're also getting calls daily from concerned business owners who feel the impact on their bottom line. And perhaps most importantly, the people that we're encountering on the streets, that you encounter on the streets, they do seem to be more sick, both physically and mentally. We find them more disconnected from services, and we find that they need significant help and support to try to find their way out of homelessness. And frankly, we find many who say no more often than they say yes. Recognizing the challenges and impacts, about 2 years ago, the city of Sacramento began to take a more proactive approach to try to address homelessness. We completed an analysis in the fiscal year 14-15 of what we as a city are spending on homelessness, and we found that in 1 year alone, we spent over $13.6 million. Keep in mind, this is only city funding, and it's predominantly general funds. We further looked at the ways in which those funds are spent throughout the city, and we broadly found 3 categories. The first category we called the impacts. Half of our expenditures as a city, $6.5 million a year, are made to address the community impacts of homelessness. And these are not fun things to talk about, and they're certainly not the ways the city wants to be spending our general funds, but they do have real impacts on the quality of life for our community. These includes things such as cleaning up debris that's left behind when a homeless encampment is abandoned, capturing and sheltering the pets of homeless folks when they go to jail or the hospital, and securing vacant buildings when homeless encampments are squatting in some of our dangerous buildings. The second category that we captured, we called services. And I think this echoes what was just said. We spent almost $2.5 million to provide services for people while they're homeless. The predominant cost in this category for us was EMS transports to the emergency room. And clearly that is a community service which every resident of the city has access to regardless of the housing status. But it was really important for us to separate that cost out because evidence shows that once people are stably housed and connected with services, their dependence on the emergency medical system goes down and their personal health increases. So really a positive personal and community outcome. And the third category that we delineated was what we called investments. In the 14-15 fiscal year, the city spent just over $4 million on programs and services, specifically to provide solutions to end homelessness. Already this fiscal year, that amount has increased to over $6.6 million, of which $2.4 million comes directly from our city's general fund. These are programs as varied as shelter, outreach, assessment, rapid rehousing, and employment services, but critical to us as a city is that all of these services are oriented towards a housing first model. And while these numbers are specific to the city of Sacramento, I'm very confident that our neighbors throughout the state, our cities and counties, are spending proportionate amounts, even if they haven't been able to measure it precisely as we did. So what does this mean? For Sacramento, it reaffirmed our commitment to remain focused on solutions. Housing is the only thing that will end homelessness, and only with solutions that end homelessness are we going to be able to reduce those other impacts that our city feels. but it also underscored for us the need for collaborative regional approaches that recognize the transitory nature of homeless people and also the myriad of services and interventions that are needed that the city alone cannot bear. As I'm out on the streets of Sacramento, whether with our police department or our fire department or with our homeless outreach navigators, there's one thing that's abundantly clear to me, as I'm sure it is to all of us in this room. There's no one standard path into homelessness, and there is no one path out of homelessness. Our systems of care must recognize that the path out of homelessness for most people isn't linear, and there's going to be setbacks and forks along the way, and we must have the resources, the flexibility, and the tenacity to meet people where they're at and walk alongside them. Luckily, Sacramento is incredibly fortunate to have amazing partners who are just as focused on solutions as the city is. Our nonprofit Continuum of Care lead, Sacramento Steps Forward. Through them, we've created a robust and responsive front door to our homeless system of care. This coordinated system aligns the needs of people who are seeking assistance with those resources that we do have. We also have an amazing partner in our county, which is incredibly critical to us. They've quickly stepped up to align their housing support program and their Prop 63 funded permanent supportive housing into this broader continuum. And then most importantly, probably, we have really creative, resourceful nonprofits working here every day and championing for the continued commitment of the city and the county to take a leadership stance on behalf of those who often don't speak up for themselves. The work that Sacramento has been undertaking in the past year or two to create a true system of care took the dedication of many, including the elected local officials, funders, frontline staff. But what we have now, and what we're very proud of, is an integrated system that focuses not just on managing homelessness, but on ending homelessness. But what we are missing, like I'm sure most communities throughout the state is affordable permanent housing. Our community, through partnerships with the city, the county, some private funders, have been able to create shorter-term rapid rehousing, like what Cynthia spoke about, and employment programs for some of our lower barrier folks. But we really struggle with providing intensive, ongoing supportive services that are necessary for our more chronic populations. And this is why we're so excited about the No Place Like Home initiative and the resources it will bring to local communities who are committed to housing those who are the most difficult to serve. We really appreciate the flexibility that the initiative gives to local governments to build off effective systems and to expand on the good work that we're all already doing. I'd also like to welcome the opportunity to help in any way, since you're right here and we're right here. I'd love to invite any of you to come on a walk along with any of our street outreach navigators to really understand the populations out there who are falling through the cracks every day. We'd also love to serve as a pilot funding program so that you can see the outcomes of the commitments that we make and that you make to end homelessness on a daily basis. I'd like to just end by saying that the place that we find ourselves in today, with the increased attention on the so-called homeless problem, is really a double-edged sword for so many of us in this room. We certainly never want to hear that people are suffering, and we also don't want to hear the struggles that our communities are facing and feeling disconnected and left behind. However, with this attention, I feel comes greater opportunities to think big and to challenge the standard and to come together to make meaningful and lasting changes. So I thank you for your time and the opportunity to address you.
We thank you, Ms. Elkin, and thank you for the invitation to join you in the community so that we can see some of the challenges you're facing here in Sacramento.
Thank you. We'd love to have you.
Mr. Ehrlich, welcome to our committee.
Hello, everybody, senators. My name is George Ehrlich. I worked in Sacramento County, Department of Public Works, Division of Highways and Bridges for 25 years. I also was an alcoholic and intravenous drug user during that time. Toward the end of my career, I had a couple close calls, scared me, and with an alcoholic and addict thinking in mind, my choice was I needed to quit my job. I didn't have the courage to quit alcohol and drugs. A couple years later, I had supreme intervention. I got arrested on drug charges. And the nature of that crime, I lost everything. my homes, my cars, my boat, everything I accumulated for 25 years working in Sacramento County. They sent me to prison. I got out the first time out. Condition for parole is you have to have an address and a job. I couldn't get neither. I was 50 years old. I couldn't get a job. I went back to prison, tried it again. Got out, was homeless, couldn't get a job, and I was diagnosed with chronic depression. I wanted my life to end. But I went back again, got out in April of 2000, and they gave me a bed at Salvation Army. They had an outreach program from TLCS. This woman came in, gave a presentation of what TLCS can help me do. I liked it, so I signed up. A week later, she came pick me up, and she took, my name came up on top of the list. I went to a place called Carol's House, which is part of TLCS, which is a 30-day evaluation program. And they helped me get my life back together by getting my California ID, my Social Security card. I got on welfare assistance. I got to an RST, which is with my psychiatrist, so I can be on medications. And after 30 days in that evaluation program, they said I qualified for one of their other programs, which was transitional living called Palmer House. It was a one-year program. So I went there, and they told me they would help me get my life back together. And as an alcoholic addict, you kind of lose perspective on things that we find normal today, like making your bed, cleaning your room, cleaning your apartment, your hygiene. They helped you get all that back together. My life was starting to come together. December of that same year, 2000, I was asked to volunteer as doing a Narcotics Anonymous program and in-house. So I did, and needless to say, my volunteer services within the community as well as with TLCS took off from there. I also did, I gave up Monday Night Football for 38 months and taught the big book of Alcoholics Anonymous to an all-women's recovery house called Starlight House for River City Recovery. I floor matted and put together a program for Quinn Cottages called Dual Diagnosis, and I ran that program and taught the residents there how to facilitate it, and after 7 months, I turned it over to them. And then Sacramento County Mental Health gave me an award for doing that, and after 6 years, one of the managers of our admin team asked me to join the board of directors, and I joined that board of directors. That was 8 years ago. And I'm still on that board. My services are just like, I love doing what I'm doing. Of course, I only make $20,000 a year on retirement, but I put $100 a month away because we have a fundraiser every December in the first week called Comedy Night. It's a fundraiser for TLCS. And I donate $1,000 to them. You know, and the question I would ask everybody in this room would be, what's the price for a new life? I made a commitment to my board 4 months ago that I will continue to serve on that board for another 8 years as long as they vote me in. I think that'll be no problem. And I'll be 74 then. But I'm still not going to be done servicing my community. When it comes to homelessness, it's not pretty. It's hard. It's really hard. But in celebration, December 1st, this last December 1st, I celebrated 18 years of sobriety. And thank you. And after taking psychotropic medications and the sleeping aids and other medications like that for 14 years, the 23rd of this month, Tuesday, I celebrated 4 years without no medications. My life is where I want it to be today. And thank God that you guys approved this budget and these fundings to help people like me. I want to thank all of you. You saved my life. That's the truth. And that's all I have to say.
Well, we like stories with happy endings.
Yeah, very happy.
Thank you for sharing that with us and for giving us a sense of the depth of the challenges that you faced and what people on the street are facing every day. And your commitment to them is more than encouraging, it's inspiring. Thank you, Mr. Ehrlich.
I'm not done.
Oh, very good. Did I interrupt you?
Pardon me?
I think I interrupted you. Please continue.
Huh?
You want to continue? Oh, you're not done with your work?
Yeah.
I understand, okay.
I'm done talking, but I'm
All right.
helping my community. That's.
You have to excuse me, I've got to keep the clock watch, so we've got multiple jobs here. Thank you very much, sir.
Thank you.
So I'm going to start off with a few questions, and I don't want to suggest in any of them that anything that we've heard from any of you indicates that the answers to these many questions are simple or easy or readily addressed. But, and excuse me if I'm a little San Francisco focused, but the issues I'm going to bring up relative to my familiarity with the issue in San Francisco is not unique to San Francisco. It happens to be at the far end of a very expensive housing situation, but everywhere in California has experienced some shade of it. So we all have something in common here. Director Najendra, you had mentioned in one of your first comments that first and foremost, we want to get people back into housing, but that does presuppose that there's housing to get people back into. And we are struggling so to build housing. Of course, developers are for profit. They are business entities. And so what drives their investment dollars, which are significant to build anything in San Francisco right now with the cost of labor, with the cost of land, and the limit that we have surrounded by water on three sides, is to build that which will bring the best return on investment. And so we continue to build tower after tower. Colleagues tell me, well, you created your own problems. You didn't build enough housing. Well, we're building, and the average cost of a unit is $1 million. So that doesn't benefit any of us sitting here, much less Mr. Ehrlich or anybody who's in need of housing because they're currently on the street. So that's a major challenge. And San Franciscans have been very generous at the ballot box. They have recently approved, I think we're the only city in the country that has approved a general obligation bond to build affordable housing. That means property owners will pay a little bit more in their property taxes to contribute to the greater good of building housing. But it's only a few $100 million, and that only gets us so far. One thing that we didn't hear about, and that I do want to bring up because I think it's the other side of the equation, is that we have to be as preventative in our efforts as well to keep people in their housing. In San Francisco, our most valuable affordable housing stock would be our rent-controlled units. Now, not every place in California has rent control, but we are among those that do. Only those units built prior to the enactment of the local ordinance are rent controlled. So anything built since 1979 is not rent controlled, and anything built in the future is not rent controlled. So every time we lose a rent controlled unit, it's irreplaceable. And of course would take great public subsidy to recreate in the form of an affordable housing unit. There was a study presented to the Board of Supervisors recently that said for every 10 new affordable housing units that the city builds, we're losing 8. So we're barely treading water. And why are we losing 8? To no-fault evictions. Tenants who are paying their rent, they're good neighbors, they're good tenants, they've done nothing wrong, but speculators buy their buildings with the intent to evict everybody and then subdivide and sell them off as tenancies in common or cooperatives. So they're taking affordable housing off the market for personal gain. And you'd wonder, well, that's bad public policy. Why don't you try and do something about that? Well, we have a state law, which is known as the Ellis Act, which was designed appropriately for landlords who want to get out of the business of being landlords, and they can use it to evict their tenants. There are restrictions on what you can do with those units for a number of years afterward, but it was a law passed for landlords. It is now being abused by people who aren't landlords and don't pretend to be landlords. They're speculators. And we tried to differentiate between the two, and the special interests here in Sacramento stopped us. And this was just to be a local bill for San Francisco, wouldn't touch the rest of the state, and they came after this as if it was the most egregious act upon their members. And so we run into opposition just to craft thoughtful public policy so that we can keep people, because if you lose your rent-controlled unit in San Francisco, you are literally homeless. You cannot find another rent-controlled, and anything non-rent-controlled would be possibly 5 to 10 times what you're currently paying. So then we also have an inclusionary zoning ordinance in San Francisco that requires that a percentage of all new market rate housing be below market rate. And that is a subsidy by the developer, but because the developer is in a very profitable market area, they did not oppose the inclusionary zoning ordinance when I had the opportunity to author it on the county board 15 years ago. The debate in San Francisco right now is what should that mandate be? It's currently 12%. The Board of Supervisors is debating whether it should go to 25%, which is indeed another arbitrary number. Might there be a study to determine what actually can the market bear? Those are all questions being asked right now. But again, if we're building 100 units at 12%, you get 12 below market rate. And when we talk about below market rate, how do you define that? Much of it is for people who are earning many times the median income, which in the Bay Area is upwards of $75,000 a year. And then the federal support that we've lost over the past number of decades, and I can point fingers at both Republican and Democratic administrations, Republican as well as Democratic Congresses, they have retrenched. We have a note in our analysis here that we suffered greatly in terms of affordable housing units and investment in them through the sequestration. Section 8 housing vouchers is one of the last remaining benefits that we get from the federal government. But if you look in Craigslist, you will see advertisement after advertisement that says, no Section 8, no Section 8, no Section 8. It's a guarantee. The renter must pay 30% of whatever that renter's income is, and then the federal government will pay the balance. On a $1,500 a month unit, it could be $450 paid by the renter, $1,050 by the federal government. But landlords are just excluding them from even eligibility to be considered to be vetted to become a tenant. We're going to try and do something about that legislatively this year. We think the law says you cannot discriminate against someone just because their source of income is coming from the federal government. So we keep bumping into a lot of challenges. A lot of the situation that we're dealing here is created by bad public policy making. And I'm not here to say that it's a one-sided story. Landlords and property owners have their rights as well, so it does get complex, and there are multiple voices to be heard. But again, getting back to where I started, get people back into housing. We have to have housing to begin with. We've got some new models in San Francisco right now, sort of shelter plus. Shelters traditionally would separate men from women, so couples couldn't be together. People with pets could not bring them in. You could only have so much personal belongings, and anything more you couldn't bring in. So a lot of people just stayed away from the shelters. So we're changing a lot of the barriers that kept people from coming in from the outside so that we can begin to stabilize, to get them into transitional, to get them into permanent supportive. And then with all the other confounding challenges of that individuals face, especially once they are on the street, and how things only go downhill from there, whether we're talking physical, mental, or behavioral problems. So I'm not, to lead to a question, and then I'll pass it to my colleagues. Mr. Agenda spoke from a more national perspective, but I know you've had time in the Bay Area, so just wanted to see any additional responses you can offer to help us with all of these extraordinary challenges.
I think you were just speaking about the San Francisco Navigation Center. Is that you were?
Yes.
The new model. Yeah, we think that that's.
And now on Pier 80, 100 to maybe a 200-bed model after Navigation Center.
And that's an excellent model. And the key to that model working in terms of the, because it's had such a high rate of housing placement in the cities, are the city's permanent supportive housing units, being able to attach people to those units. And that's why it's a great model, but it's hard to scale because
Those
you're going to run out of units.
Get filled up, and then they're just backed up. And
right. And so
forward.
I think my first comment is this sort of, everything you have said speaks to why the issue is so complex and why so many different partners are needed to create a really systemic response to homelessness. It really just can't be the homeless service providers or city funding or even just federal funding. One of the things that we saw with this initiative to end veterans homelessness across the country was an infusion of resources that by the dollar figure that should have been enough to end veteran homelessness for every veteran. But because of the complex social and political and bad public policy in certain localities, trying to undo that, the money just isn't enough. There's all these other things that have to come together. In California, the CalWORKs program has been a really interesting sort of experiment in that it's in all of these very expensive communities. So we had a day-long conversation with San Francisco, Alameda County, Sacramento County, LA, and I think, and Santa Clara County about how are they finding housing, how are they using these rapid rehousing dollars, and how are they getting their outcomes. It's very challenging. They are, they've really innovated these programs to really have the right staff at these programs. You're not using social workers anymore to find housing. You're using people with landlord and leasing and property management backgrounds to really go out there and negotiate leases and things like that and create kind of really deep landlord engagement. But they're needing city and county financial incentives to be given to landlords. Often this is happening not just in California, but in places like New York City and other really expensive DC. So on the one hand, I think the programs have become more innovative at finding housing for these folks. I know that there's a lot of people walking around with vouchers who can't find people to take them, landlords to take them. Some of that has been sort of more effectively resolved by actually having program staff who have the experience to go out and negotiate those leases instead of having the people themselves do it. And that has proven to be more effective. And what we're seeing is that people are only using about 3 to 6 months of rental assistance to stay in those housing. The rapid rehousing model is helpful insofar you don't have to build, right? You have to use existing units as long as they're existing units. But all of these communities that we spoke to did say, the market is getting saturated. It is getting harder and harder to find. People are moving from San Francisco out to Vallejo or Fresno. They're having to move far away from their communities to find affordable units. But eventually that too is probably going to be more and more saturated. So candidly, yes, you have a really tough housing market in San Francisco and across the state. In terms of permanent supportive housing, building those units, I think that, the federal HUD will certainly sort of keep funding that kind of, that investment. And I think it's important to remember that permanent supportive housing really is for a small percentage of the population. So maybe 10 to 15% of your population. I know San Francisco has a high percentage of chronically homeless people, but it is a smaller percent of your population. So you don't need to build permanent supportive housing for 8,000 people. It's really for the small, really high need population. And the rest of the population really needs sort of 3 to 6 months of rental assistance is what we're seeing. In the Bay Area, it might be 9 months, a little bit longer, but that's what we're seeing from the data from the California communities that have this housing crisis. So yes, you have a really tough housing market, and that is something, and in terms of prevention, the more upstream solutions, that is definitely needs to be part of whatever systems you're building. And I think all of these communities are trying to involve diversion from the homeless system, people who don't need to come into the homeless system so we can keep them where they are, and then eviction prevention, moving upstream, which is a little bit harder for the homeless assistance system to handle. It's kind of something that we need other systems to be able to help. And New York City is heavily trying to move upstream in that direction to preserve its housing in the same way. But it is something that we need other partners to come in and help with.
On the CalWorks housing, I think all of us heard from our county welfare departments urging us to augment what the state was contributing. And we put in about $30 million in last year's budget. The governor slashed it to $15 million.
Yeah.
So again, we keep running into challenges.
The outcomes are pretty incredible. I mean, we are looking at some of the data from Sacramento, for example. It's looking like with about 3 to 6 months of rental assistance, there's about $8,000 per household. That's ending that person's homelessness for $8,000. So, and the outcomes are pretty high. People are exiting to housing at like a 60 to 70, sometimes 80% rate, and staying in that housing for over a year. So the outcomes in the CalWorks programs in these very expensive localities are having very good outcomes. They could certainly use help with landlord engagement, but they're experiencing strong outcomes.